What's going on, everybody? John Stamper. We are here live in Chicago, and we are excited to put together what is a special episode of the Beyond the Operatory podcast. First and foremost, we just want to say, if you have subscribed to this podcast, whether it's on YouTube or Spotify or Apple, we want to send you a big thank you. The Dental City team is super excited about putting this together. We've already had a lot of great feedback from the first couple of episodes, and you're in for a real treat as we finish 2026. So with the Dental City team being here in Chicago at the Midwinter, as you know, Dental City is partnered with a lot of great companies. That's what makes this family really strong. And so we wanted to take some time, spend a little bit of time with them at their booth, have them share maybe some things that you may not know as a dental practice, as well as what's new. So many of these great dental companies, as you know, they're always doing new things. And one of the things we also want to have them share is what is a great way for you, the dental practice, to be able to send feedback to them, learn more about what they're doing. So we're going to be spending time here today with a lot of those different companies. We're going to put together this special episode of Beyond the Operatory, which is live from Chicago Midwinter. So be sure to check it out. Again, if you like the podcast, we'd love to have you subscribe, whether you watch on YouTube, Apple, or Spotify. We're going to continue to be putting some great episodes together, all in an effort to help you grow your practice. Thanks, everybody. We all know that the companies that you work with, the products and services, are such a big part of what you do on a daily basis. And so we're excited to be here at the Zurich Dental booth, and we're excited to be with Kate Reinhardt from Zurich. How you doing?
Yeah, I'm awesome. It's been a great show already, and it's already day one.
I love it. All right, so I want to jump right into it. As we were talking about, Beyond the Operatory is kind of the theme of the podcast. And there's a lot of things that you all help practices with, but could you maybe talk about a couple things that practices may not know about how you can help them?
Yeah, certainly. So one of the biggest things that I like to talk about when I'm working with the practice is education. Not just continuing dental education, but education on how their systems are working and the continuity with systems. So if we can get everybody on the same page from the start, that's going to be a way for you to set a system in place and actually have it maintain its integrity. On top of that, the compliance piece of it too, not again like OSHA and whatnot, but compliance within your own systems and finding a spot where you can create a log, create accountability and responsibility within those systems. So again, not only is everybody trained on it at the same time and at the same education, but also we have a system in place so that you can maintain it and not have any disruption, even if there's new team members, even if there's a big staff turnover. So I would say for sure education and compliance, but not in the typical way that you would think about it.
Always cool when you get the opportunity to speak with someone who's been here since the beginning, and you've seen a lot of exciting things. So Sandra, it's nice to be with you. How you doing?
Thank you. I'm very well, thank you. Our product makes the dental experience more comfortable and safer and faster. And I think clinicians and patients all want that. To really maximize the benefits of this product in a practice, you have to really implement it into your workflows. It'll shorten practice procedures anywhere from 20 to 40%, depending on the procedure. Sealants can take half the time. Crown and bridge, instead of an hour and a half, it takes an hour.
I'm with Yasmin, who is with Hexa, one of the Dental City partners, and they're doing a lot of great things for dental practices. She works in the special market space. Yasmin, how you doing?
I'm good, thank you. Thank you for having me. We're a manufacturer of preventative restorative line. And we have all our baby lines as well. We have Cavex and Lascott and Mixpack and all that. We're doing a lot of homework. We're doing a lot of research. We're asking. We're sending our products out for testing. We're getting feedback, and we're constantly keeping up with the times. So we have a lot of dentists we work with. We have a whole team behind us, and we're really sending our products out and just seeing what people want, what dentists want, and changing. So that's something that we're very proud of. Maybe people don't know that, so I'd love to share that.
As you can see, we're at the Orablock booth. We're with Deborah. Deborah, how you doing?
I'm very good. How are you?
I'm doing wonderful. And all right, so the first thing I wanted to ask you is, what are a couple of things that dental practices may not know about Orablock?
Okay. First of all, we are actually the only other manufacturer of Articaine in the U.S.
Okay.
Every other Articaine other than Orablock is manufactured by another company.
Okay.
So what's important about that is how we manufacture our product.
Okay.
The other company, they use terminal sterilization. Means they manufacture the product and then they sterilize it. They expose it to high heat to sterilize it. We sterilize all the individual components separately using sterilization methods that don't involve high heat. And then we bring them together in a sterile environment. So where that means for the customer is we have a longer shelf life, 24 months as compared to 18 months. Our epinephrine's more stable, and that enables us to be able to have that longer shelf life.
So very excited to be with Michelle, who is from Tokiyama. And many of you may know this company from Omnicolor, which she's going to get into. But Michelle, it's good to be with you. How you doing?
Thank you so much. It's great to be here. I'm doing great. Day one of CDS, always exciting. A lot of dental offices don't know that Omnichroma is a one-shade universal composite covering A1 through D4 in a single shade, which means it does not contain dyes or pigments to give it shade. So we rely solely on something called structural color, which occurs naturally rather than relying on dyes and pigments. So no matter the shade of your patient, Omnichroma is going to shade match to every single one of them.
We're here at the Halyard booth. Very excited to be with Bobby. How you doing?
Good, how are you?
I'm doing wonderful.
I think first and foremost, it's just our name is well known in the industry, right? We used to be Kimberly-Clark. We spun off and became Halyard. So we've been doing this a long time. I think we do a pretty good job at it. Yeah. And we have the #1 branded glove in dental. So what every dental office needs to know about Halyard is they're going to get a high quality glove that's not going to rip, tear, fall out of the box, not cause hand issues. And when you're wearing the glove for 45 minutes to an hour, you want to be happy. And that's what we can help them be, is happy.
Very excited to be with Kelly here. As you can see, we're at the Pro Edge booth at the meeting. Kelly, how's it going?
Great. It's been a great show so far. Really appreciate having us on. We were Pro Edge Dental Water Labs. We were the largest dental water lab in the world, focusing on water treatment and water testing. But now we're Pro Edge Dental Compliance Labs because we're offering more than just water now. Yep. So we have moved into spore testing and sterilization monitoring. We're launching that here at Chicago Midwinter, and we're really excited about that. So we've got a new brand, and as we expand into new product categories. So very excited about that.
What are a couple things, Kara, that dental practices may not know about GC America?
Well, first of all, were you aware that we have products that identify, then prevent, and then restore?
Okay.
And why that's a huge factor is we're looking at the optimal health for a patient, and we're here to help you out with that workflow.
What are some of the things when a practice starts to use Hexa, maybe 30 days, 60 days in, some of the feedback that you get?
Yeah, you know, we're here to fill the void so that companies can compete with, like dealers can compete with the big dealers. Any voids that you guys have, we have very good quality. A lot of our products are made in USA or made in Germany. And we're able to afford a really good profit margin as well for the dealers as well. So I guess that people are surprised by the quality. We have very good quality for the price that we give. So that's something that we're very proud of, and we're getting a lot of repeat customers based on that as well. So I guess that would be like a surprise thing for them.
When I say that and then I tell them it's 20% less expensive, they say you should have started with that. I think the biggest thing is in sales, we talk about an unmet need. And as salespeople, we go into an office and we try to find a way to help meet that need. Well, with anesthetics, the dental offices are usually very happy with the product they're currently using. And sometimes there's a lot of hesitation to make a change. I'm using this, I've had good luck, I'm not having a problem. If I switch, am I going to have the same level of anesthesia, the same confidence? So the nice thing I tell the dentists is that Dr. Gordon Christensen reviewed Orablock, and as you know, he runs an independent dental testing facility. He doesn't take advertising, he doesn't take free product. When he reviewed Orablock, he named it a best product. And the reason for that was rapid onset of anesthesia, profound anesthetic effect, the longer shelf life, and the lower cost. So what I would say to that practice is, however you've been using the other Articaine anesthetic, continue to do it the exact same way you always have, because it's exactly the same product. Look at the prescribing information word for word, exactly the same. But just know that you're going to have a product that's going to give you that same profound anesthetic effect and that same rapid onset of anesthesia.
Sometimes I get a little bit of shock. Sometimes I don't. They don't believe me right away, just because they're so used to a traditional setting where it's A1, A2, A3. But the one that blows them out of the water is the fact that Omnichroma will shade match even after bleaching, because it's dependent on the patient's tooth color only. So even after they bleach or as they get older, that will follow the color of the patient's natural dentition.
You know, being able to be out here all these shows, I will tell you not to beat our chest. What we hear all the time about our gloves, especially lavender, is I use that glove, I love that glove. Why? Why do you love that glove? Whether my hands are wet, dry, clammy, it goes on like butter. It's smooth, it fits, it conforms, it doesn't rip. You don't lose dexterity when you're touching instruments. But that's what it is. They love it. And my job is once that gets on their hands, they don't want to take it off. To me, that's a win-win.
Yeah.
They're really impressed that we have programs for them.
Yeah.
And those programs allow them to dabble in products that they may have always heard of but haven't instituted yet.
Yeah.
And they get to have the products that they know and trust, but then be able to add what they are wanting to learn more about. And what's great is we've expanded our team in order to have that local support where they will be getting that every 3-week support that maybe they're not used to at this present time.
What are you guys most excited about when you look out over the next year or so with conversations you've been having with dental practice or some things on the horizon? Anything that you're really excited about?
You know, we're growing our line. We're getting a lot of opportunities. Obviously, we're being selective with who we choose and who we add to our portfolio, but just the growth in our line has been really amazing to watch and very exciting to continue.
Michelle and I were just talking about a lot of the great things that they're doing to help practices on the onboarding side, but that's just not it on the education. So what are some additional ways that you're helping practices on the educational side other than just going to the website?
Yes. So with Omnichroma being such a new product and a new concept, we do a lot of awareness, education, webinars, CEs and everything like that. You can find all of that information via our website or Viva Learning, Dental Learning, anywhere you can find your normal CEs. We will be there with a lot of different types of webinars and how you can utilize Omnichroma and how that structural color comes into play. Because structural color is something that is Omnichroma specific. Structural color is, there's two different kinds of color producing phenomenon. There's chemical color, there's also structural color. Chemical color is the purple in my shirt, it's dyes and pigments added, but because Omnichroma does not contain dyes and pigments, structural color is, in an example, morpho butterflies or a spilled gasoline puddle. Those fun colors that you see is just the manipulation of light. Omnichroma basically works off of that, something we call smart chromatic technology, and it actually uses structural color. We're the first and only composite to rely solely on structural color rather than dyes and pigments.
That's awesome. I learned about structural color. Now I'm going to talk about that with my wife and dyes in our clothes and all
Great.
that good stuff. So
Glad to hear it.
That is a nugget that you have to hear. Thanks, everybody. Any final thoughts just on kind of in general, like how you're helping practices, but then more importantly, kind of just, you know, the work that you guys are doing?
Yeah. My favorite thing about going into dental practices is hearing from them 3 weeks later and them saying like, this was a change that we needed and we didn't know that we had. I think if you're gonna integrate a system into a practice, just go all in. Don't be wishy-washy about it. If you're thinking about needing a system, you probably actually need it, so don't delay. The further away from normal you get, the harder it is to come back. So take the time, invest the energy, invest the resources so that when it comes time to put it into place, you're ready.
A lot of people, when we changed our name, thought, oh, we got bought by somebody. It's like, no, we did not. What we did is we changed our name. Our name, Xyrus, is a compilation of the zygomaticus major and risorius muscles, which are two of the muscles that help you smile. And so Xyrus is our way of remembering that we are working with smiles to foster and generate happiness in the clinician and the patient.
That's awesome. That's a great way to end this. Thank you so
Fabulous.
much. I know the Dental City team is really excited about this new partnership and introducing all the great work that you guys are doing to a lot of their customers. And good luck at the rest of the show.
Thank you.
Awesome.
We're super excited.
Well, what's great about working for GC America is that we truly think of the patient. The patient is our end user. And in order for our patients to have that optimal care, we need to work with clinicians that also have that same message of we want to preserve natural teeth, keep the teeth healthy, motivate the patient to have the optimal health.
The website is www.orablock.com, and there's a really nice 7-minute video on there that talks about Orablock and how it compares to the other Articaine anesthetics. It talks about how we manufacture the product. So kind of it'd be nice if you're starting to use Orablock and you want to do a real quick lunch and learn for your product. It's 7 minutes.
Okay.
You want to do a nice quick lunch and learn for your office staff?
Yeah.
Great location to go.
Okay.
The best place to start is on our website. We have an excellent website that gives up a bunch of education. And if you scroll down far enough, you're going to be able to find a spot where you can book a demo call with myself or one of the other consultants. And that's just a free consultation that you can ask any of the questions. I want to hear about your pain points. What are the challenges you're experiencing? We talk through some of the little tips and tricks that we can integrate into the practice right away. But then we get to the bottom of what are those pain points or why are we having them? Oftentimes it's simply just lack of organization.
Tokiyama.com or Tokiyama-us.com. We also did launch a new website, omnichroma.com. Please check it out. But you can learn a lot of information. We are always available via phone or email if you have any questions at all.
Perfect. Michelle, thanks for your time.
Absolutely.
Good luck the rest of the show. I know the Dental City team is really, appreciative of the relationship that they have and to get the word out. So we really appreciate you taking the time.
Thank you so much.
All right. Thanks, everybody.
We have free CE all the time. You can go to our website, proedgedental.com. On the resources tab, there's our webinars are there constantly. We do some of them live, some of them on demand, but that is really kind of a constant for us. We're always doing that.
Awesome. Kelly, thanks so much. I know the Dental City team really appreciates the partnership. Definitely wanted to spread the word about the great work that you guys are doing, and good luck here at the show as you launch a lot of new things.
Thank you, sir.
Yeah.
Appreciate that very much.
You got it, absolutely.
Yeah.
Well, we have a beautiful website that you're able to go on. We're also on LinkedIn, where you will see many of us posting all the exciting aspects that are taking place. Go to Instagram, go to Facebook, we're everywhere.
Love it. Kara, thanks so much.
Well,
congrats on the success. I know the Dental City team really appreciates the partnership, and good luck the rest of the show.
Well, thank you, John. It was
Awesome.
great.
Thanks, everybody.